Welcome back in. You're watching Living Smart in the Lowcountry. We're here at St. Joseph's Candler, of course, and if you're just joining us, tackling some big topics today. Right now, we're going to check in with Dr. Gary Thomas and talk about breast cancer and the state-of-the-art treatment that they have here at this facility. Thanks so much for joining us.
Thank you for inviting me.
Gosh, we have really a lot to talk about in just a short time. I want to start though with how has breast cancer treatment really evolved and changed over the course of just since your career has begun?
Well, it's amazing to see the improvements we've made over the last 30 years. I've been an oncologist now for over 30 years. It's hard to imagine. And the treatments have really evolved amazingly well. I never thought I'd see all these improvements over that period of time. Surgery, which is one of the backbones for breast cancer treatment, has really de-escalated, believe it or not. So when I was a young doctor, the theory was to cure a patient, you'd have to remove the entire breast. And they would remove the breast, mastectomy. They would even take the muscle underneath. It was a very disfiguring surgery. And now we're able to do lumpectomies where you just remove the tumor itself with a normal margin around and then follow that up with radiation. That's an option for most women. So it's the theme of the breast cancer advancements has been de-escalation of therapy.
Wow.
So that's been great. The radiation is more effective, more targeted, and that results in less side effects and much shorter treatment times.
What a huge, amazing outcome for the patient then, just not having to deal with, such trauma after the fact. So that all sounds amazing and part of the state-of-the-art treatments, but talk to us a little bit more about some of the state-of-the-art treatments that we can really see here.
Sure. Well, one thing I would like to add is we give about 70% less chemotherapy than we did, say, 10 years ago. And that's because of the personalization of the tumor. Now we can look at a tumor's DNA and determine which women really need chemotherapy and which don't.
Wow.
And it's called a 21 gene recurrence score, and it can give prognostic and predictive information. So it can really predict what a woman's outcome would be, say, 10 years from now with or without chemotherapy. So it spared so many people from having to take unnecessary treatment. So that's a big plus for breast cancer treatments. You probably have heard of immunotherapy, where you're actually receiving an infusion where you're trying to rev up your own body's immune system to attack the cancer cell. So many cancers, melanoma, Hodgkin's disease, lung cancer, for instance, those treatments have been revolutionary. Breast cancer, it's lagged behind a little bit, but more recently we found a particular subset of breast cancer called triple negative breast cancer, a very aggressive type breast cancer, usually seen more often in African American women or Hispanic women or younger women in particular. If you combine that with chemotherapy, you can have dramatic shrinkage of the tumors and very good outcomes. So we're really excited about that. So immunotherapy is one. There's another class of drugs called antibody drug conjugates, which are really new type treatments in cancer medicine. They're sort of smart bombs. They're like a Trojan horse, where it's like chemotherapy in the sense that you inject it in, but it targets the cancer cell itself, and then it opens up and hits the cancer cell. So there's less side effects, more efficacy. So those are two areas where I'm really excited about.
That's incredible, yeah, and having less side effects, obviously amazing for the patient. Let's discuss, gosh, we have a minute and a half left, but I want to talk about how being a research facility really is a benefit to your patient. What does that mean for them?
Clinical trials is really the backbone of oncology advancements. So all these things I've been talking about that all came as a result of women getting into clinical research studies. So we're very blessed here at the Lewis Cancer Center that we have a team dedicated for that. We have two oncology nurse navigators, so to speak, that help us identify if a patient would be a good candidate for a clinical trial. Now, trials are not for every patient. Some patients are afraid of them, but if we identify a trial that might be very helpful for a patient, we always encourage them to at least consider it. And through the Lewis Cancer Center, we have a nationwide reach where we can participate in these national trials. So it can be very, very helpful. I always believe that you should always have as many smart people getting on your case as possible. So we collaborate with cancer centers all over the country. Sloan Kettering, MD Anderson, Mayo Clinic, MUSC. So we're very excited about the things that we can offer to patients here in the Lowcountry.
Absolutely. Well, your patients are in good hands here at St. Joseph's Candler. Dr. Thomas, thank you for taking some time with us today.
Oh, it's my pleasure. Thank you for having me.
We appreciate it. And we'll be back with more Living Smart in the Lowcountry. We hope you'll stick around.